If your child suffers from chronic ear infections, you know the drill all too well. Endless nights of pain and tears, back to back rounds of antibiotics, and the looming threat of surgery. You're tired of band aid solutions that never address the root cause. Once you've experienced this even just a time or two as a parent, now you begin to worry like mad every time that they get even slightly congested, or even if they have a common cold, worrying that it might spill over and build up into chronic ear infections again and again. For many parents, this is exactly the case, round after round of ear infections, followed by round after round of pediatrician and ER visits, and of course, round after round of antibiotics and all of the side effects that come with them. By the age of 3, it's estimated that 80 to 90% of kids will experience at least one ear infection, which should then get us asking the question, what's the difference about the 1 out of 10 kids who do not get ear infections? If you'd like to stop the cycle of chronic ear infections or prevent them altogether in the first place, then you've got to watch this video all the way through. What if we told you that there's a way to break free from this cycle of suffering without relying on drugs or invasive surgeries? In this video, we'll reveal the hidden cause behind most chronic ear infections and share a new, natural, drug-free approach that's helping children find lasting relief. This video is for parents of children struggling with chronic ear infections who are seeking answers beyond antibiotics and surgery. If you've tried all of the temporary fixes and want to address the underlying cause of your child's recurring ear infections, then this information is for you. We'll explore the surprising link between poor drainage, subluxation, and chronic ear infections. You'll learn how birth interventions and early life stressors can set the stage for all of these issues, and discover how neurologically focused chiropractic care can help restore your child's natural drainage and immune function. So I want to tell you a story about Luca. Before chiropractic care, Luca would get an ear infection every time that he got sick. At one point, he had 5 ear infections in 4 months. Luca's mom felt so bad that he would wake up in the night screaming in pain, and even after going on antibiotics, it would clear up the infection just to come back again with the next cold or virus that came along. He was on antibiotics back to back for months, and she knew that that wasn't good for him long term, but didn't know any other options. Their pediatrician suggested going to an ENT for tubes in his ears or some sort of other surgery, but mom didn't want to go that route if she could avoid it. After hearing about pediatric chiropractic, she reached out to see if chiropractic care could help with recurrent ear infections. From her first call with a care advocate, she felt like her concerns were heard and that she had found a place and seen other kids like Luca here in the office. Mom felt hopeful that they would be able to help. When mom saw Luca's scans, she was shocked to see how much of him was in the red. When the meaning behind the scans was explained to her, it made total sense why his body wasn't able to fight off these ear infections easily. Since they started chiropractic care, Luca has not had a single ear infection. Of course, he still gets sick, like most kids do, especially preschoolers, but the colds never turn into ear infections, and he also seems to be able to get over the illnesses easier. Mom believes that his overall immune system is stronger and that he has experienced less frequent illness since they have been doing consistent chiropractic care. When they do catch something, a couple of extra boosts get them over the hump and back to good health quickly. There are many ways to help kids get through ear infections without antibiotics, surgery, and all the side effects that come with them. The natural solutions and options not only help get through the challenges, but it makes the body stronger as a result of it. Chronic ear infections occur when there is recurring buildup of fluids, inflammation, and swelling that block the eustachian tubes, leading to pressure and pain in the middle ear. This condition is also known as chronic otitis media. Here is a picture of what happens when your ear and how it's made and what happens in an ear infection to make some of that pain happen. There are 3 primary causes of chronic ear infections that are all tied to something called subluxation. First, there is poor plumbing and drainage that results from the misalignment, causing extra tension, inflammation, and limited movement of the nerves and muscles that supply the inner ear, leading to the buildup of fluid. Here you can see something called the tensor veli palatini. That is a muscle in the ear. It's very small, but it pulls on that eustachian tube. So if there's tension and inflammation, it can block the eustachian tube from being able to drain from the sinus cavity that you can also see right there. So when that mucus starts coming up, it does not allow anything to get out of that, and it starts to build up and create what bacteria can breed and grow in there. Second, subluxation also causes the body to go into an excessive sympathetic fight or flight state, leaving it in a high inflammatory state, producing extra mucus as a result. So double trouble. Again, that sinus cavity is right there. If there's already a blockage, that subluxation from that C1, C2 nerve root right there will cause more mucus, leading to more ear infections. And lastly, the world that we live in has a ton of toxins, sugar, dairy, and so forth that then stir the pot and make things worse, able to make all those bacteria breed even more. Since antibiotics and fever reducers do not take the root cause head on, and in fact make the gut and immune system weaker over time, they are a major stressor for recurrent or chronic ear infections continuing to come back again and again. In the same way that many families have gone gluten-free, casein-free, added tons of supplements, essential oils, and so forth, and still struggle, showing that those things may be helping some, but do not address the root cause or subluxation entirely. Our adjustments are designed to provide two main things that help kids and patients get to the other side of ear infections without drugs and surgery. First is they increase drainage and plumbing by getting things moving and clear once again, often immediately. They balance out the nervous system and help reduce the sympathetic fight or flight state, reduce inflammation, and just overall take stress and tension away. In our office, the path to natural solutions and overcoming chronic ear infections begins with what we call our neurological insight scans. These scans directly measure the stress, tension, inflammation, and subluxation that so often builds up in the upper neck of infants and children struggling with chronic ear infections, stemming all the way back from birth interventions like forceps, vacuum, C-section, that can create physical tension, twisting, and pulling to the upper neck and middle ear areas, leading to all this trouble in the first place. To learn more about how chiropractic can help your child overcome these challenges and to get your child scheduled for their neurological insight scans, you can hit the link in our bio on Instagram and learn more today.